One of the other very common sexual dysfunctions for men is a disease that is named after the man who first described it. It's called Peyronie's disease. It's an extraordinarily common problem where scarring of the two cylinders in the penis that fill with blood with erection tether the penis so it misdirects, and it can be up, down, sideways. But the curvature can make intercourse almost impossible, and oftentimes it makes it quite painful. And again, men are reluctant to talk to anyone about it and are reluctant to seek medical attention. Happily, there are treatments that we have that can be very helpful to these men, particularly if the curvature of their penis is such that it makes intercourse almost impossible. The cause of the scarring in the cylinders that fill with blood in the penis remains a mystery to us. It is interesting that a common condition seen by hand surgeons called Dupuytren's contracture, or in some cases it's referred to as trigger finger, is a similar process, and men who suffer from Dupuytren's contracture seem to disproportionately have the problem. So in some senses, most of us think it's more a connective tissue disorder, and one of the things we always try and reassure the patients is that it isn't something that they've done. Oftentimes men blame themselves, saying some bizarre sexual practice must have led to this problem, and that's almost never the case. When we see men with Peyronie's disease, the first question that I always ask them is it possible for you to have sex? And then if the answer is yes, do you have pain when you're having sex? And if the answer to the first question is yes and the answer to the second question is no, in general, we take a very benign approach to trying to treat them. The treatments are generally instituted for people who either have such severe pain or such severe curvature that they simply can't have intercourse. And in that situation, we begin oftentimes with medication. The second treatment that we now use is an injection of a medication directly into the scarred area. And this was a technique that was used first in people with trigger finger or Dupuytren's contracture. And what it does is it tries to release that fibrous scar and soften it up so that the tissue regains its ability to stretch. The last treatment that we hold in reserve is surgery. And in that situation, you actually go in and you excise the area that is scarred. And depending on how much of that tissue you have to remove, in some cases a graft has to be put in place. And that oftentimes restores a good deal of straightening to the penis to make sexual intercourse possible.